Than 150,000 Nigerian children are born annually with sickle cell anemia. Now, persons living with sickle cell anemia experience a lifelong struggle with pain during spouts of crisis, and this sometimes leads to a redundant lifestyle as well as limited social and physical activity. We'll take a look at some of the complications that could arise from having sickle cell anemia and how many warriors are doing their best to live normal lives. TVC's Kemi Balogun reports.
In 2008, the United Nations General Assembly adopted a resolution that recognizes sickle cell anemia as a public health problem and one of the world's foremost genetic diseases. Sickle cell anemia is a condition which affects the red blood cells in the body. It is a genetic condition which is passed from parents to their newborns, and it is not contagious.
So it is not an environmental disorder. It's not something you can contact from someone. It's a genetic disorder that is usually transferred from parents down to. So in that case, now you have patients with sickle cell anemia having problems like you hear about sickle cell crisis. Now at this point, because of the nature of the blood cells, they cannot transport, in their means to transport blood to certain parts of the body. They get accumulated, and the body's response to lack of oxygen is pain.
Rabi Medunama and Hafiz Adeyemi are both advocates for raising awareness on the importance of genotype testing. As warriors themselves, they carry on with life as best as they can, but having this condition brings with it some major setbacks in their life.
You know, I just grew up to be this strong-willed person, strong-spirited, and I could just do anything. You know, I had my challenges, missing school, missing the university, even for like 2 years and all that. At a point in my life, I couldn't walk again. I was bedridden for like 2 years.
Kind of channel my job into something much more positive to get in terms of creating an awareness on something that I know it is personally affecting me, which is on sickle cell, which is why most of the projects I have done, especially the films, are on sickle cell.
Sickle cell blood cells are not the usual round-shaped cells. They become stiff and sickle-shaped, restricting the blood cells and the oxygen they carry from moving freely around the body. This causes severe pain episodes for a warrior, which is referred to as sickle cell crisis.
We don't have experts on sickle cell. We only have hematologists. And that is only one part of the disorder they understand. Of course, the blood is the main part that causes it, but then it brings about so many other complications.
Pain management of the sickle cell crisis remains very key in the reduction of deaths and complications of the disease, like stroke, acute chest syndrome, blindness, and bone damage. Over time, persons with the disease can have organ damage to the liver, kidney, lungs, heart, and spleen. But hospital management of pain and crisis comes with its own challenges for most of those with the condition.
I have to try and do what I can at home. Then if hospital comes calling, then maybe. Except it gets beyond the moment where, okay, there are some things I can't do myself, probably, or the pain medications that I have at home can't handle it anymore.
There is a 50% chance that any child conceived may be born with sickle cell anemia if both partners have the trait. So far, the possible cure for sickle cell anemia is through undergoing a bone marrow transplant, limited to the number of those who can afford it and can get a suitable donor. Persons living with sickle cell anemia can live normal lives, especially when they adhere to the basic principles of staying hydrated and also limiting stress. But the ultimate remedy remains that everyone needs to know their genotype. Kemi Balogun, TVC News, Abuja.